Appreciate everybody taking the time to join us here today so that we could discuss a topic that's very near and dear to my heart. It may sound funny, but it's been such a tremendous revolution in terms of the way that we are able to take care of folks from a surgical perspective that I'm very excited about it. First, I'll introduce myself. My name is Ed Armbruster. I'm an orthopedic hand surgeon with Mercer-Bucks Orthopedics, and I operate on conditions from the hand through the wrist and the elbow and the shoulder. I've been in practice since about 2007, and I'm happy to be with Mercer-Bucks for about over 10 years. Very briefly about myself, I'm a native of New Jersey, having grown up in Atlantic County, and I pursued undergraduate at the University of Michigan. I went to graduate school at Boston University, and then medical school at the Philadelphia College of Osteopathic Medicine. I did my residency at Rowan University in Glassboro or Stratford area, and I rotated through AI DuPont and Cooper University hospitals. In addition, I did a hand surgery fellowship up in North Jersey at New Jersey Medical School, Rutgers, and then I came and started practice. So again, I specialize in hand and upper extremity issues and conditions, and I think that this lecture, like I said, hopefully will be very informative for folks. Certainly we have a lot of time for questions, and I definitely welcome them. And actually, if you happen to have a question about a different kind of surgery or technique or anything else, you're certainly more than welcome to do so at the end of the presentation. And thanks again for joining us. So I'm excited to talk about WALANT. And WALANT is an acronym. It stands for Wide Awake Local Anesthesia with No Tourniquet. And I'm going to discuss that, what it actually means, and why the heck do we do it in the first place. So again, as I mentioned, it stands for the Wide Awake Local Anesthesia, No Tourniquet. So the patient is wide awake for the procedure. If you think about it, it's very similar to if you go for a dental cleaning, or if you have a root canal, or if you have a crown or something of that sort. Many times, these don't require sedation or being put to sleep or what have you. You can very effectively be taken care of with pain relief and numbing by injecting Novocaine. And the Novocaine can be very effective, as most of us know from having had dental procedures. And most times you don't require being sedated. So it's revolutionized surgery, because typically and ordinarily in the past, we've taken people to the operating room and you're either sedated, where you're in a bit of a twilight, like if you were to have a colonoscopy, or you could be completely asleep under general anesthesia. While with these kinds of advances, that's no longer necessary. Now, it's not for every kind of a procedure. It's only for certain type of procedures, and I'm going to list them for you so you have a bit of a better understanding as to what that's all about. So as you see here in the second bullet point, the surgery is performed with the patient wide awake. So you'll feel a bit of a pinprick from the needle. You get the numbing of the Novocaine, and then you don't feel a darn thing. Typically, we'll put some music on. We'll have a little bit of a chat. You won't see anything either. There is a drape for sterility purposes to keep everything clean, but we could put on your favorite music. We talk about whatever you like. And many times these procedures are rather short to begin with, sometimes 5 or 10 minutes, depending upon exactly what it is that we're doing. The local anesthesia is administered by myself. I usually give a freezing spray, which helps to numb the skin in the area of the injection. And then we provide the injection, which is a combination of 2 medicines. And the medicines help to provide immediate pain relief, like Novocaine. You get that shot and bang, your fingers and hand or what have you will go to sleep immediately. And then we'll also have another medication in there, which lasts a little bit longer. It's very similar to Novocaine, but it lasts longer. So it takes a little bit longer to come on, and then it lasts longer, and then it takes longer to come off. So ordinarily, folks will have relief of their pain or any discomfort for typically 12 to 14, sometimes even longer, 16 hours following the surgery. So the surgery, the technique was initially developed by 2 surgeons. The one we typically refer to is Dr. Don Lalonde. He's an orthopedic hand surgeon up in Canada. And there's also Dr. Ali Phillips, who's in the United Kingdom. Dr. Lalonde noted some difficulties and issues that were occurring with the Canadian healthcare system in terms of getting folks in for rapid care, rapid alleviation of their surgical problems, and also trying to reduce the costs associated with care, which we'll discuss in a moment. So as a result of these pressures or these stimuli in the environment, he was able to develop this technique, which of course is spread around the world. And in fact, Dr. Lalonde has a web page, and he's on different media such as Facebook and LinkedIn and so forth, and people will contribute their photos and their videos and their cases as we continue to expand WALANT surgery across the globe. So what are the benefits to WALANT? Why would anybody consider even doing this? Well, first of all, you don't have to fast. If you have a procedure done ordinarily with anesthesia or sedation, you can't have anything to eat or drink after midnight the night before the surgery. Well, with WALANT, you don't have to worry about that. You can eat right up to the moment that you're getting wheeled back for the procedure. So you can have anything to eat or drink. You can have your lunch or your breakfast, your coffee, anything you ordinarily do. You don't have to fast because you're not going to sleep. You don't have to discontinue medications. Sometimes we have folks that are taking different medications for various reasons, and they have to stop them. Anti-inflammatory medications can make folks bleed with surgery. Anticoagulants can help folks bleed or make them bleed as well if people have issues with clots in the past, or more commonly, atrial fibrillation. A lot of times those people are on Eliquis, or they'll be on Coumadin or other medications to keep their blood thin. Well, as you may be aware, especially folks that take these medicines, coming off those medicines can be problematic. It can cause a risk because it can increase the risk of having a blood clot. That risk, of course, is rather small. However, it's present. But if we can keep the patient on the medication without stopping it at all, we, of course, reduce the risk to the baseline. So there's no increased risk whatsoever. You may be concerned about bleeding, but we put a medication in the Novocaine, which actually helps to stop the bleeding as well. So although we do the surgery routinely, and I operate on folks that have blood thinners or anticoagulants, I haven't had any difficulties, knock on wood, with folks having excessive bleeding. So we've been very fortunate in that regard, very successful. You don't require preoperative clearances. So you don't have to go to your primary care doctor. You don't have to see your cardiologist. You don't have to see your dentist or what have you. And yes, sometimes we require dental clearances for different procedures. But for doing WALANT surgery, you don't need any of those. You don't have to go and get any blood tests, no EKGs, none of that. So that makes it a lot easier just to basically figure out the problem, pick a date for surgery, and then we get going. These days, the only thing that we do have to do is get COVID testing, which is a mandatory requirement by the state authorities, of course, in order to ensure a safe environment for patients, the staff, and the folks working in the operating room, including myself. There's no tourniquet that is required. One of the things that has been troublesome to people over time is that when we operate on hands or wrists or what have you, we have to apply a tourniquet. Now, sometimes we'll still use one because it can be helpful to visualize the structures inside of the body when we're performing the procedure. Tourniquets are used, of course, to restrict the blood flow going to the hand or the elbow or the wrist. Of course, if we don't use a tourniquet, we can have difficulties with seeing the structures we need to see. Sometimes I say to folks, it's almost like operating in the bottom of a mud puddle. If you can't see what you're doing, well, then you can't be successful with it. Well, without using a tourniquet, you can have bleeding. But as I mentioned before, we use a medication inside of the injectable, inside of the Novocaine, that helps to limit the bleeding. And so for that reason, although occasionally we may put a tourniquet on, we don't have to use it. It would be very unusual that we would have to use it. The tourniquet can cause discomfort by squeezing the top part of the arm. When you squeeze that for 5 or 10 minutes, it's typically not a problem. But for longer procedures that can go 15 or 20 minutes or longer, the tourniquet can become problematic and painful because we don't inject Novocaine up here. We only inject Novocaine in the area where we're doing the procedure. So for this technique, we don't even require a tourniquet. There's no IV. For people who hate needles, this is a huge plus. You don't have to worry about getting an IV. You don't need the IV antibiotics and so forth. You don't need intravenous fluids. For people who do need antibiotics, which actually is a very small percentage of the people that we operate on, we give them oral antibiotics. So you take a couple of pills before the surgery up in the preoperative holding area or on your way into the surgical center, and that takes care of your requirements for antibiotics. But again, it's only a small portion of people that need antibiotics. Typically people who have a replaced heart valve, a prosthetic joint such as a total knee, a total hip, a total shoulder, or people that have diabetes. There's no sedation, so you don't have to worry about waking up and being foggy, being disoriented. Some people develop nausea, although I will tell you here at the Mercer County Surgery Center, the anesthesiologists and the crew, they are second to none. So our issues with anesthesia and post-operative nausea, vomiting, so forth, they're really very minimal. But even with the WALANT, you basically have none, zero. You don't have to worry about sedation, feeling groggy. You can go right back to your normal activities. I have folks that come in, they get the procedure done, they go down to Atlantic City, they travel, they'll go out to dinner that evening. It's really minimal disruption to your normal life. And as I mentioned, no anesthesia side effects, no grogginess, no fuzziness. Sometimes I have folks that come in, they're in their 90s. They're concerned about being put to sleep because sometimes you can be fuzzy for a period of time following the anesthesia. But with a WALANT surgery, it's not necessary. You don't have any of that fuzziness, no general anesthesia or sedation is required. So what are the other advantages? Well, you have a shorter postoperative stay. Ordinarily, when we operate on folks, you'll be in the postoperative recovery room for a period of time, perhaps 30 minutes, an hour, or longer, in order for the anesthesia to wear off, the sedation to wear off, and for the person to come back, to being wide awake. Well, with WALANT surgery, you don't have to wake up because you never went to sleep. And so in that regard, once you come out of the operating room, you go to the recovery room, and you're awake and you're comfortable. We give you a little snack there. And once you're ready to go, you get dressed and you're out the door. So typically 5 or 10 minutes, when you're comfortable, you can head out and you can get back to your normal activities. In fact, you can drive yourself home. Transportation issues are sometimes problematic for people. Tough getting a ride in, tough getting a ride home. With WALANT surgery, you can drive yourself home. Now, there's always a small risk with folks that develop numbness, but if we're only operating on one side, typically people are very effective with driving their cars, and thankfully we haven't had any problems. Most people say that they're very safe, they feel very safe, they feel that the anesthesia was effective, and they would do it again if they needed to have another procedure in the future. The outcomes are very comparable. So you may say, well, is it better for me to have anesthesia? Is it better to go without anesthesia with the WALANT? It really doesn't affect the surgical technique. We can do a number and a variety of different procedures, which I'll share with you in just a moment. So whether you have sedation or general anesthesia, go completely to sleep, or have WALANT, doesn't make any difference on the procedure itself. We make sure that we check the type of a procedure that you're having, and that can be done in the safest of means and the most effective. We're not going to compromise efficacy or safety by doing WALANT. This is something extra and above what we can offer with our standard techniques and procedures. The patient satisfaction rate is great. When I operate on folks that have WALANT, let's say for a carpal tunnel surgery, when we talk about doing the other side if they need it, over 95% of folks will say, yeah, I'm going to do the same exact thing because it worked out so well. There's very, very little anxiety because people can sometimes become nervous with sedation or with general anesthesia. But with WALANT surgery, the satisfaction is great. Most patients overwhelmingly would elect to have a second procedure with WALANT because they've already had the first one done. And there's lower cost. So one of the costs, of course, for anesthesia, or for surgery rather, is the cost of anesthesia. To have a qualified anesthesiologist who's board certified there at the ready, and to make sure that you're safe during the procedure, make sure they monitor your vital signs and so forth. And they administer the general anesthesia or the sedation medication. Well, with WALANT surgery, an anesthesiologist is not necessary. For some of the smaller types of procedures, this is ideal. And you may consider that, well, maybe it's nice and comfortable to have an anesthesiologist. And certainly we don't want our anesthesiologists getting into trouble by having hands that aren't busy. But at the same time, if we can take a look at what the costs of anesthesia services are to a population, to an insurance carrier, then the least of all, or most of all, I should say, to our patients, there's no increased cost. So you don't have to pay an extra amount of money for any deductibles you may have. The insurance company doesn't have to pay more. And so we can get the same procedure done with a lower cost, same efficacy, same satisfaction, and the same safety profile. So in that regard, it's pretty much a smash hit. What kinds of surgeries can we do? Well, I mentioned before that we can do carpal tunnel surgery, things like that. And this envelope continues to expand as physicians and surgeons around the world continue to develop, adopt, and innovate with WALANT surgery. So currently at the surgical center here, we're doing carpal tunnel release surgery. I would say over 95% of those carpal tunnel release surgeries that I do are WALANT, whether that be an open procedure or an endoscopic procedure with the camera. Trigger figure releases, these are great. A small injection right in the area of where we're going to do the procedure, a small incision, 5 minutes later, 2 stitches, literally a Band-Aid. you're out the door. You're using your hand right off the bat. We try to minimize downtime. Tendon repairs can be very helpful with WALANT surgery. Why? Because when you're repairing the tendon and you're bringing the ends together, you want to make sure that that tendon is gliding properly. You want to make sure that the tendon tension is exactly accurate and that there are no hiccups, there are no catches or areas that might get stuck. By having the person awake, they can move and use their finger, and you can make sure that everything's functioning appropriately. Again, you don't have the issues with anesthesia, fasting, and so forth for the patient. For the surgeon, it's very helpful because we can make sure immediately that what we're doing works. Ligament repairs, ligaments of the thumb and the fingers or other ligaments of the hand, they can be repaired under straight local anesthesia as well. Again, it's very, very effective. Some people get concerned, they say, well, what if I feel something? Well, if you feel something, which happens infrequently, what we do is we always test to make sure that you're going to be numb. But if you happen to feel a little something, then we give you a little bit more medicine. That's all. We don't give an excessive amount. We give exactly enough, and we don't go over the top. We make sure that you are in the safe zone with the amount of medication that we provide, that you're comfortable, you're happy, and we're safe. Fracture fixation. We can pin or fix fractures in the hand, the fingers, metacarpal fractures, the thumb, and even into the wrist. Sometimes we can do wrist fractures proper. Those can be very effectively addressed with using WALANT technique. Again, the person can be wide awake. This is again ideal for younger kids who have fractures and even older people who may have some concerns regarding their anesthesia. Also, if a person has atrial fibrillation and they may be taking an anti-inflammatory or more commonly a blood thinner, we don't have to stop that medication for them. So typically, we have to stop it for maybe 4 or 5 days or 7 days before we can do the procedure. Again, there's a risk with doing so. But with WALANT surgery, we can do the block, we can do the surgery, we don't have to stop the anticoagulants. Much safer, and we can get that person to the operating room sooner so that we don't have to worry about a delay in terms of getting their fracture fixed. And mass removal. Small ganglion cysts, small masses or lumps or foreign bodies. If somebody has a sliver of glass, a piece of metal, a deep splinter, things of that sort, they do really well with numbing that area up with the medication. I've also done skin grafts for skin defects, and actually, without getting too graphic, amputations. Sometimes if a person has a severe injury or they have other problems of their fingers or their hand where they require an amputation, we can actually do it under straight local anesthesia. Very safe, very effective. Well, I've come to the end of my presentation. I know that that's been a tremendous amount of information, but I hope to have at least covered in a general sense what WALANT surgery it is, what it stands for, why we do it, and what the benefits can be both to the patient as well as to the surgical team. If you folks have any additional questions, I'm more than happy to answer them for you in the question and answer portion, or even right here verbally. Please go ahead, fire away with any questions about the presentation, or if you have any other questions about Mercer-Bucks orthopedics or about hand and upper extremity surgery. Again, I want to thank you all very much for taking the time to join us today. I'm going to go with the first one here. Are you performing these procedures during COVID? That's a great question. So yes, we are performing the procedures during COVID. As I mentioned, everyone who comes into the center needs to be tested for COVID. We usually test 48 hours before. We can offer that testing here at the center. And then during the testing period, so you come in, let's say on a Wednesday for a surgery on a Friday, during that 48 hours, you have to quarantine at home. And then as long as the testing is negative, we move ahead to surgery. The nice thing about the surgical center is that it is a COVID-free environment. We do the best that we can to make sure that everyone that's in the 4 walls of the center is tested, is screened for COVID, including all the staff, all of the patients. And that's something that, of course, hospitals try to do too, but we are very, very strict here as well in terms of making sure it's a safe environment. So yes, we do these procedures and larger procedures during COVID, as long as the state allows, and they are on board with that. Is anyone a candidate? Well, yeah, for the most part, yes. It depends upon a couple of factors. 1, if you're comfortable with the procedure. 2, if the procedure is appropriate for your WALANT surgery. So for instance, let's say a person was coming in for a knee replacement. Well, that wouldn't be a good procedure for a WALANT surgery. Or a shoulder arthroscopy with a rotator cuff repair. That requires a little bit more anesthesia. But for procedures of the hand and the wrist and even up to the elbow, yes, most of those procedures are candidates for WALANT. And I can certainly discuss that with individuals on a case-by-case basis. Is the procedure covered by insurance? You bet. In fact, most insurances prefer that individuals undergo WALANT surgery because it's a lower cost for the insurance carrier and for society as a whole. So although they don't mandate it, they don't require it, they actually appreciate it when we move ahead in that regard. Of course, the insurance coverage and the insurance company, in terms of making the decision for appropriateness for the patient, it really doesn't add into the factors for consideration. But on the back end, it is a nice benefit. Is the recovery time the same? Well, the recovery time in terms of the recovery immediately following the surgery is faster with WALANT, like I mentioned, because 5-10 minutes, you get dressed, Band-Aid on the hand or the wrist, you're out the door. In terms of the recovery from the surgery, they're typically the same. Now, for my surgeries, I typically try to get folks working with their hand and their fingers and their elbow and what have you immediately. So back in the day when I did my training 10 years ago or more, when a person had a carpal tunnel surgery, they had a larger incision on their hand and they would be in a splint and they'd wear the splint for about 2 weeks and then we'd get forward with removing the sutures and so forth. These days, we do the surgery, it's about 3/4 of an inch to an inch, unless we do endoscopic, which is a small incision here, and then it's done through the camera. Many times you only need a couple of stitches, if any at all. A Band-Aid literally goes on that area, and I ask you to use your hand immediately so you don't have to worry about having it becoming stiff or weak or what have you. So the recovery actually for the surgeries that we do here is actually typically quicker than most. Okay, the middle finger becomes immobile momentarily and has some pain just below the finger. Is this a trigger finger and how long is recovery for such? So from what you're describing, it certainly sounds like it is a trigger finger because it gets stuck and pops and clicks. Usually people with trigger fingers will have pain or tenderness right in this area for the middle finger in the palm. So if you touch there and it's sore and it gets stuck and it pops, chances are that you have a trigger finger. Of course, you'd benefit from an evaluation and then we could discuss treatment options. Many people do very well without surgery for trigger finger, but the folks that do require surgery for it, they typically choose to do WALANT surgery. They're wide awake and they do exceptionally well. Surgery appropriate for the CMC joint? Yes, the CMC joint and CMC arthroplasties can be successfully completed with WALANT surgery. That's expanding a little bit further as well. It's a little bit more involved than a carpal tunnel, trigger finger, what have you, but we can do WALANT surgery safely and effectively for CMC. Sometimes for CMC, because the procedure is a little bit more involved, we will prepare the patient for the possibility of sedation. So some of those factors we discussed in terms of medications or fasting, we have to adjust those slightly. But most times, folks do very well with CMC arthroplasty with WALANT surgery. It's a passion of mine, and I appreciate you taking the time in the middle of your day to have a look at this and let me speak about my passion. So we welcome you to come by the center or the practice anytime. We could take a look and see if WALANT surgery is right for you.
Thank you, everyone. And if you would like to schedule an appointment, you can go online at www.mbortho.com or call our main line at 855-896-0444. And if you do have any additional questions that you think of after the presentation, please feel free to email me at programs@mbortho.com. And between Dr. Armbruster and I, we will be sure to get back to you. Again, thank you, everyone. Enjoy the rest of your day. We'll see you.
Thank you, everyone. Take care, be well, and stay safe.